Good afternoon, everybody. Welcome to Leo Live. I'm really thrilled to have our guests with us. That we talked about workforce last week and told you we'd be talking about it for 2 weeks. Obviously, we could talk about it every week. Really pleased to have Dr. Sonja Stewart with us, and I'm going to introduce her in a couple of minutes with the help of a PowerPoint slide. And then, do you have PowerPoint too, Sonja, or you're going to present?
I do.
Okay,
I think it's easier to have a visual.
All right, so I'll put ours up, and then I'll put it down. Or Kerry will actually, because I'm using the phone today. And welcome. Somebody just, Kerry, can you read the chat?
Yeah, I'm taking care of it.
Great. Oh, cool. We got friends here from Western Mass, I think.
Yep, the Brain Injury Clubhouse.
Great.
Yeah, that's awesome. Well, now that we have a doctor in the house,
Just not that kind of doctor.
Well, it's almost 12:05, huh?
Well, it's past 12. We're good. We're good to go. I'll continue to let people in.
Okay. So do you or Kathleen have the slides or handy, or should I try to do it from here?
They should be shared.
Okay.
Do you see them, Carrie?
Yep.
Okay.
Okay, so I probably just have to go to the contents on the phone somehow. I saw when I came on. There it is. Thank you. So let me put in a plug to advocate and continue. The Senate budget is actually, we expect it to come out early this week. So, and that's consistent, as my colleagues keep telling me, with the way it's been during COVID. So hopefully you've been reaching out, and that's the posting here for the issues, obviously, that the biggest one being the workforce and Chapter 257, as well as the ARC and ADDP have been pushing forward, maintaining the increases in rehabilitation and AFC through the ARPA monies, to continue those long term. So, all right, next slide, please. And just a reminder about the webinars that we have every week here, and then every month on Thursdays. Morris Sullivan and Ellen Taverna do a federal and state government affairs session. And then Kerry Mahoney has varying topics during the course of the year. And I know you just had one recently. What's coming up soon, Kerry, the next one that's coming up?
We've got a couple of in June. The ones in June are demystifying Chapter 688. Lots of confusion. Schools, families, professionals. So Diane Latiskas is going to be kind of setting us straight in terms of what happens with a 688 referral. And then we also have Kathy Kelly from Mass Rehab Commission. She's a benefits specialist. She's coming in June, and she is going to be talking about, if your kiddo wants a summer job, how does this all affect Social Security? What can you do? Are you going to lose Mass Health, Medicaid? There's no reason why you have to lose it. So there's alternatives. So she'll be going through all of that. So
that's great.
You can make it.
Sounds like great topics. And, it's interesting. I just saw something, looking for something else on the Wisconsin website, I think published by the schools, there must be an overall superintendent. And it was so informative about Chapter 688. And I wonder, I know we have a lot of materials in our state, but this was literally written so clearly. So I'm dying to talk to you down the road, Kerry and Kathleen, about what's up already from the state and what are things that we could help do, get done looking at that Wisconsin example. All right, if we could go to the next slide, please. Okay, what a picture here of Dr. Stewart. So Sonja Stewart is the Vice President of Community Services at Berkshire County Arc. In her role, she oversees family support, employment, community-based day supports, and day rehabilitation services. Inspired by the work that Sonja does every day, she focused her thesis on examining the job satisfaction of direct care workers during COVID-19 across settings throughout the United States. And she successfully defended her dissertation in February. So she now holds a doctorate in educational leadership from the University of New England. And so again, in front of everybody, I got the wrong name at the top there. You can take our slides down now. Congratulations, Sonja. You can see my editing was incomplete. We'll have to fix that before we send it out, but that's very exciting. And I'm really excited to have you.
Thank you. I appreciate it. It's been an honor getting to this point, and it's great to continue the work and be able to share what I found. So research is heavy, it's thick, and sometimes it's dry. So I tried to make a presentation that can kind of help break this down. And hopefully it helps as we go into this advocacy season to bring awareness. It is published. I'll share that publication link with Carrie. Anyone who can use this to their benefit, or if it inspires future researchers, that's really the big goal, is to carry this work forward. So I'll get this slideshow shared.
And so what we'll do is, Sonja, we'll add it to the PowerPoint. Like if you send us your PowerPoint, we'll turn it into a PDF. Or we can add that link to the corrected, edited
Sure.
one that I just spoke. Okay.
Yeah,
go ahead.
Absolutely. So I got my doctorate through the University of New England, and my topic for my thesis was examining the job satisfaction of direct care workers during COVID-19. And I did a quantitative study, which is essentially a study by numbers. It uses a survey. And below is my team who helped get me to the finish line and make sure everything met the standards. So shout out to them. So a dissertation takes years. So this has been a culmination of years. It just happened to also coincide with the pandemic, which I think kind of made a unique twist on this. It also consists of 5 chapters. So those chapters are broken down, and each chapter covers a different part of the research. So to start, you always got to have a problem statement. And from our world, we know that the workforce crisis has been an ongoing problem. It's been going on for nearly a decade, and some people have said it's unsolvable. The same research that's out there also says COVID-19 has made this problem worse. So really my problem statement was, how can provider agencies gain more knowledge to help overcome this struggle we've been having? My research questions were really impacted by the pandemic. I recognized it started in March of 2020, and my research went through December 2021, which, as we know, this has continued. There was a huge bunch of literature. So your chapter 1, essentially, you're explaining what the problem is. Like if somebody wasn't in human services, you're explaining what it is we're living through. Your chapter 2 kind of gives all of the existing research on what's contributed to this problem and what have been the suggestions to solve it. So that's a really long chapter where we really delve in, and there is research on satisfaction and dissatisfaction, but none of them relate to COVID. So that's kind of what made my study unique. But really my purpose was to examine the job satisfaction of the folks who worked in COVID-19. And I wanted to look across the country, because didn't matter where you worked or what state, or and I also looked at various jobs. I looked at nursing homes, I looked at home health aides, PCA workers, residential care, hospitals. So really any kind of direct care was invited to participate in this study. The research questions that I specifically wanted answered related back to my survey. So I use Spectre's job satisfaction survey, which is a pre-made survey that's already been proven to be valid. And my goal was to get direct care workers to take this survey to understand what areas they experienced high levels of job satisfaction during the pandemic, and what areas did they have job dissatisfaction. So when you're doing research, you have to ground it in a conceptual framework. And when I started on this journey, this was a concept that was really, really large to me. So hopefully I can explain this that makes sense. So a man named Herzberg, he came up with a theory of job satisfaction in 1974. And essentially he said, there's two areas that make up someone's job satisfaction. There's motivation, which motivates you to do the job, it makes you happy. And then there's hygiene. It's the areas that you're dissatisfied. So if you see hygiene in my PowerPoint, it means dissatisfied. And that's how Herzberg identified it. So you would look at the areas that make people happy, and you want to foster those areas, and you look at the hygiene factors that made people unhappy, and you would want to address those essentially. So that was my conceptual framework that grounded my research. Then there's a theoretical framework that kind of delves a little bit deeper, and I used human capital theory for this, which is people need to be invested in. We invest in a lot of other areas of business, but sometimes we just expect people to do work without the right compensations. And I think you hear this in human services, like there's not a lot of money or not really good benefits, and we try to solve those issues. But human capital theory really promotes that we need to invest in our staff's development and our staff themselves. But these two frameworks really grounded my research and what drove it. So for participants, who was asked to participate? I did everything virtually because it was the pandemic. So I used a software system called RedCap, and that's what made the survey virtual, where it was protected, it ensured people's information wouldn't get leaked, and it's got a lot of safety features that kind of made it so people had safeguards if they chose to participate. And I posted the survey to 2 direct care Facebook groups with the moderator's permissions. So ultimately, 39 people completed the survey in its entirety. And I'll point out why I think that number was so low in my limitation section. But in order to participate, participants had to be a direct care worker, such as a personal service attendant, a personal care worker, a nursing assistant, a home health or home care aide. They had to work in the United States between March 2020 and December 2021, and they had to be over the age of 18. So for methodology, this was like your methods of collecting the research. So it starts with the data collection process, which was creating the survey and posting it out to those Facebook groups. So when setting up the RedCap survey, because the survey I got was a paper, so I had to input everything into that software, which was really fun. That's something I enjoy doing. And then I made my first post on December 13th, 2021. So this is around, we're during the holidays, but also keep in the back of your mind, Omicron came out. So we had another really big resurgence of COVID at this same exact time. So that post went for 2 weeks. And then on December 27th, I did a second post, which is right in between Christmas and New Year's. So again, we have COVID's really high. We have the holidays. This is normally a time where staffing's kind of crazy at agencies. So those are things to keep in the back of your mind. And then my survey closed January 10th, 2022. At that point, I started analyzing the data, which then would go into my chapter 3. You kind of explain how you analyze the data. And then chapter 4, you explain what you found, what did you discover? So a data analysis. Again, we're keeping Herzberg's theory in the back of our mind of what motivates and what are the hygiene factors of satisfaction. And then Spectre, who created my survey, said there's essentially 2 ways you can analyze satisfaction of people. There's the global, like globally, do they like their jobs or do they not like their jobs? And then there's the constellation approach, where you look at each of the areas of employment and you can kind of see which areas they like and which areas they dislike. So when you take a group of people and you survey them, you could just look at that group of people and say, okay, on this scale, they're happy or not happy, or they're ambivalent in between. The other approach you can do is there's a sample population of every person in different categories that took this survey already. Here's what their norm is. So the overall satisfaction norm. So you can compare your group of people with the norms and see if your population is more satisfied, dissatisfied, or the same as the established norms. So I did both. I did all of the areas because I wanted to cover all of my bases. So for this chart, to kind of explain it, you have the norm, so the giant pool of people who've taken the survey, and then you have my sample study to compare. So globally, the norms score 142.9 in overall satisfaction, and my sample study scored 124.66 with a difference of scores in 18.24. So essentially, direct care workers who work during COVID-19 are more dissatisfied than the general norms. So that was kind of concerning and something to make note of. How you figure out if somebody's dissatisfied, they have to range between 36 and 108. Ambivalent, meaning you're not dissatisfied, but you're not really happy, is 108 through 144, and satisfied is 144 through 216. So our sample study did fall in the ambivalent range, but closer to the dissatisfied. Even the general norms, they're not in the satisfied range. So that's something, again, to make note of, that, you know, our workers aren't satisfied right now. So we have work to do to get them to that happiness range of 144 to 216. So just looking at my sample study satisfaction score, like I said, you can look at the subcategories. So I broke that down to hopefully make this easier to
Sonja,
Yeah.
hi. Can I ask you a question? And I hope I don't throw you off by asking you one.
No, you can, absolutely.
But that last chart, the norms, right,
Yeah.
that are there, how, when was the most recent, when you compare that, is that several years of doing the study and they normed them? And just so people understand how recent that number is, because it honestly seems high to me.
So
Okay, the 142.
it is cumulative. So if you go on Spectre's website, he lists every research study who has done this. And it depends on the study. So he'll classify them. These are all of the studies that were conducted for social services. And it's active. So my study was actually added to these norms. So that number is probably different today than it was when I did this, because now my research's average is in it. So it's a living, changing number. You got to constantly go on his website to make sure you have the most updated information.
So there could be several, just for sake of argument, right? That norm could be based on, I don't know how new his survey is. So, you know, the life of the survey, or maybe a year into the life of the survey, he's been accumulating scores.
Yeah. So for this norm, it's a sample size of 6,505 participants. His study he created in the 1980s. So I don't know if that's over the span of that. It could just be a pocket of time, but that's something definitely I can go on the website and kind of get dates for you on how far it goes back. But as you know, this has been a decade-long problem. So, you know, it does span time. So yeah, it can be high right now, but I think that's kind of what my study is indicating, that people right now are a lot more dissatisfied than the overall group over the years.
No, and I think your numbers, you know, I mean, I think that norm number is not higher than it should be, is what I'm trying to say.
Oh, Leo, we can't hear you.
I was saying that, okay, let me raise my volume. The norm number seems higher, so it must be previous years' impact on it because of the state of the workforce, right? So go ahead. Sorry to.
Yeah, and like you said, there could be a golden year where everything was really good. Maybe we had a lot of funding that year or something, and it spiked the number. But it's living, so it will change over time. So anybody looking to replicate should get the latest norms, because like I said, every time somebody does research, it gets added into it. So that's the cool thing about research. It's ever ongoing. So looking into the subfacets, the rating scale is a little different. So if somebody's dissatisfied, they're going to give a score between 4 and 12. Ambivalent is 12 and 16, and satisfied is 16 to 24. So you'll notice if somebody scores a 12, they are both dissatisfied and ambivalent. And if they score 16, they're ambivalent and satisfied. That's a limitation of this survey, is that there's gray areas. There's no clear-cut lines in between these scores. So also important to keep in the back of your mind. But for dissatisfied, the sample study scored that they were dissatisfied with their salaries, their promotion opportunities, and their benefits. Scores that landed between dissatisfied and ambivalent were contingent rewards and working conditions. Areas where they weren't dissatisfied, but they weren't happy, so they were ambivalent, was communication. Scores that were satisfied, but also ambivalent, because they landed in that 16 range, were coworkers. And areas that gave them satisfaction was supervision and the work itself, which I think that's really telling. I think a lot of us know people do this work because they genuinely enjoy helping people. So that was the highest scored area, and I think we can all agree that makes sense. So again, I'm trying to break this down in a way that won't be overwhelming. So I did color code this chart to kind of break it down. So what this shows is what the norms scored in each of these facets and what my sample study scored in comparison. So when looking at salary and promotion, these were the two areas that the norms in the sample study expressed dissatisfaction. However, the sample study scores indicate that they were more dissatisfied in these areas. So overall, people aren't really happy with their salary options and their promotion opportunities, but during COVID-19, people were more dissatisfied in this area. Benefits, contingent rewards, conditions, and communications are facets that the norms and the sample study either express ambivalence or dissatisfaction. But again, the sample study scored less than the norms in all 4 of these facets. For coworkers, this is a facet that was in the satisfied range for the norms, but fell into the satisfied and ambivalent range for the sample study due to a lower score. So people became a little bit more dissatisfied with their coworkers, but they weren't totally dissatisfied. It didn't fall in that range. Lastly, supervision in the work itself were the only areas where both the norms and the sample study scored satisfied. However, work itself was the only facet that the sample study was higher than the norms, meaning people were more satisfied during the time frame of the pandemic I used than pre-pandemic. So that was pretty remarkable finding. So to break all this down, what does all this mean? Again, we're using that Herzberg theory as our ground. So finding ones explains where people were satisfied and what are motivational factors for direct care workers. And findings 2 explains what makes people dissatisfied and what are the hygiene factors. So only one facet of the study indicated that the sample study participants were slightly more satisfied than the American norms. And that was in regards to the work itself. So again, I think people who do this work do it with a passion. They love what they do, and that's really important. It is believed that the life experience of individuals who require direct care are largely shaped by the direct care workers, and this is supported and is critical to those individuals living successful and valued lifestyles. So it doesn't contradict what the findings are. The existing research says, yes, people love working and helping people, and it helps people live much more enriched lives. Effective relationships often develop between direct care workers and the individuals they serve due to the long-term and close interactions of these positions. And this dates way back if you look at historical research. And the emotional bonds that are formed between direct care workers and the individuals they support are often what direct care workers identify as the most satisfying parts of their position. For findings 2, which are the job disaction and the hygiene factors, the results of the research were that globally, the sample study scored lower than the American social service norms with an 18.24 overall difference. And this can be inferred as the participants of the sample study being more dissatisfied during the time frame of March 2020 through December 2021, which paralleled with the COVID-19 pandemic. In addition to this, 8 out of 9 facets were less than the provided norms, indicating various degrees of dissatisfaction and ambivalence in those areas as well. The facets that indicated dissatisfaction coincide with what researchers Scales noted, that the quality of direct care workers' jobs remains low pay, lack of training, limited opportunities for career advancement, etc. And as a result, recruitment and retention strategies across the care industry have been impeded regardless of the ever-rising demand of workers. Researcher Giuseppe has found that the COVID-19 pandemic has affected direct care professionals, and it's considered a traumatic experience. Now more than ever, workers are at an increased risk of stress and burnout due to the fear of getting infected and spreading the infection among colleagues and relatives, physical exhaustion due to the overwhelming workloads, and concern about institutional management. So the historical research and my research combined is grounded, and we know this is a problem, and this is why we need to bring awareness. And that's the whole point of this study, is to bring awareness. Like, we're doing the best we can, but there needs to be some overarching changes for us to really make progress. So to just be transparent, I always have to point out the limitations of this study. And the first and foremost was all researchers have the intention of getting a 30% response rate. And for my study, that would have been 334 completed surveys. However, I only had a 3.5 response rate. And I really think that was because of the time I deployed my survey. It was during the holiday season, during an uptick of COVID. And I think direct care workers weren't sitting on Facebook looking to do surveys. I think they were either out in the field or sick or with their families. So if I were to change something, I would have deployed it during a different time of year and be mindful of what was going on with COVID. For myself, I use the JSS because it was a proven valid tool to foster internal validity and eliminate researcher bias, because I personally come from this world, and the direct care workforce crisis has affected me personally and professionally. So I didn't want anyone to say Sonja's biased in her research. So I did a quantitative approach, because you can't argue with the numbers. I just report what the numbers say. It has nothing to do with my own personal opinion. And this study is really easy to replicate with another sample of direct care workers if people wanted to go out and gain more data and research. And then, as I noted with the norm approach, and this kind of talks to what you were talking about, Leo, a lot of the norms come from convenience samples that have been submitted to the author in exchange for the tool. So the norm that I'm using might not be the true norm, because we can only base it off of who's submitted their data to the author. Also, the norms only come from North America, Canada, and the US. So this study may not be relevant to other countries who might look at it. And then with the absolute approach, like I noted, there's no clear-cut distinction between dissatisfied and satisfied. There's some gray areas. So in the areas that fall in those middle ranges, you truly don't know if they're ambivalent towards something or happy or upset. The implications. So what does all this mean? What's the summary of it all? What we can infer from the research is that the work itself and supervision are areas that direct care workers are currently satisfied, and those are motivations for them to keep doing what they're doing. Salary, promotion, benefits, contingent rewards, conditions, coworkers, and communications are all areas that fall in the dissatisfied range and are considered hygiene factors that we truly need to address and foster in order to create long-term change. So in conclusion, again, there was an 18.24 point overall difference between my study and the norms. 8 out of 9 facets were less than the provided norms, indicating varying degrees of dissatisfaction and ambivalence. And only 1 facet indicated that the direct care workers were slightly more satisfied than the norms, and that was in regards to the work itself. So my recommendations of what future researchers or providers should do is to take action. We need to lobby for large-scale change initiatives, and we are in that season. So if anyone can use this information to help promote their stories and bring about change, please do so. We need to gain more insight as to what fosters job satisfaction, and provider agencies should maintain the areas that bring satisfaction and reevaluate areas that indicate dissatisfaction. For future studies, I would definitely encourage researchers to replicate this study with a larger sample. And you could explore job satisfaction based on geography. One of the things I did was snowball sampling, which is if a direct care worker took my survey, they should promote it to their friends. And we did see 3 pockets of states that took the survey. So there was a pocket of direct care workers in Massachusetts, there was a pocket in Utah, and there was a pocket in New York. And just a shout out to us, the Massachusetts direct care workers did score the highest on their scores in terms of satisfaction, and the Utah workers scored the lowest. So it is interesting to see how geographically satisfaction changes when you look at it across the country. And then you could also delve into specific direct care positions, because again, I invited people from all varying roles to join this. So you could look at just one group of direct care workers and see what their satisfaction looks like. These are all my references of all the research I looked at and added into my study, and to help ground it and make sure I was doing something new and original and not just replicating. And then if anyone has questions, I'm happy to answer them.
Yeah, please. Carrie's looking at the chat as well as somebody wants to, Carrie can identify, or Sonja can, who could ask a question. I have a few, but I'm going to wait since we have only about 10 minutes left. I want to make sure others get a chance. And by the way, I do want to see if we could figure out a way to do a bigger sample with your help.
Yeah. I see Sheldon, you have your hand up if you'd like to go ahead.
Yeah, a quick question. I work with a group that develops, finances group homes and other kinds of living arrangements. I wonder if those people who were within the direct support people who work in the homes, if in fact you came away with any ideas about what we can do differently in the home design or the environments that they're working in that might lead to greater satisfaction or longevity.
Yeah, that would definitely be a different, we would have to look into kind of a different approach to that, because with the JSS, it's pretty straightforward. All of those facets, there's questions related to them for that. For something environmental, a qualitative approach, which is more open-ended, you're asking people direct questions like, what would you like about your work environment, or what wouldn't you like about it? What would you change? That might give you a more indicative response of what you're looking at specifically.
Okay, thank you.
Yeah.
Anybody else?
There's nothing in the chat right now, but I do have a hopeful recommendation that Sonja, that you be able to present this to the commissioner's office at DDS. as well as ADDP.
Yeah, anywhere it can go forward and help, our cause, because really that was the whole purpose of it, is to help at a bigger level. Because I sit within an agency where I hear the problems. I've been a direct care worker myself. I understand what it feels like. So when they ask me, what are you going to pick for your thesis? It's got to be something, you believe in. I was like, this is something I believe in. And if it will pay it forward and help somebody to some degree, then it was worth it.
I have a comment or reaction about the rise in work satisfaction that accompanied the co-worker drop. And I wonder if that's anywhere related to the fact that people were working so much, that people were dependent on them solely, and the frustration with coworkers who wouldn't come back, or, what I'm saying. They were feeling more on their back, and secondarily, actually, they felt more worthwhile because of that.
Yeah, anecdotally, I would assume that it was, people could choose to be at work, or they could claim those heightened unemployment benefits, or they could stay in human service and be an essential worker, or they could go someplace else that wasn't deemed essential, and, having to work in PPE for full shifts and be around each other. And I know some people, they sheltered in when places became COVID, and hospitals are so understaffed. I'm sure tensions were high amongst coworkers because, you're standing in solidarity, but at the same time, when somebody drops the ball, it's another expectation for you to pick up the slack. Like that's hard.
Yeah.
Ooh, Leo, I think you lost your audio.
Let me try it.
There you go. We can hear you now.
Okay. I was just going to make, it's still have a few minutes if people have questions, but I was going to make the question I was going to have. Did people identify what kind of direct care work they did?
No, I didn't ask that question. Specifically in my demographics, I focused more on general demographics, again, just with the intent of, this is an initial dip your toe into the pool, see what we can get for an initial response, and then future research delve deeper into those specific areas. And again, I didn't also want there to be any areas where people could say I was biased, or that, my personal work background could interfere in any way.
So I thought, the fact that your results weren't as, did not have as many subjects or people, wasn't diminished, because you also had the norms to work with, which is obviously a lot of numbers. And then you had the research, and the research pieces that you quoted in the presentation I just saw were pretty powerful. So that goes a long way.
I do think even though the participant pool was low, I still think the findings were significant. And I think it parallels what we've been saying, that, when people get into this line, they genuinely like it. But if they don't have the resources, sometimes you put people up between doing a job they love and a job they need to do to thrive, in their personal lives. So, I think we face barriers that other areas of the world don't face. We are bound by Medicaid reimbursement rates, state budgets and stuff, whereas large corporate business and retail, they can kind of set their minimum and they can offer a store discount on top of it. We don't have those luxuries.
Right. Lucy had an interesting question. Do you think the nature of the individuals served impacts the response as well? We don't know who they're serving, right? Because you didn't, and that's the same with the surveys when they're generally used, right? They could be seniors, they could be people who have mental health conditions, correct?
Yeah, so that's something, again, future researchers could look in. If you were going to pool a specific group, you could also pool individuals with not this survey, because again, the survey wouldn't be appropriate with that, but a parallel survey that targets the member satisfaction, and then compare the two, like, are the staff satisfaction different from a member satisfaction? And that would be a good compare and contrast survey.
Good. All right. Anything else, Carrie, that you see?
No,
We're almost-
nothing more in the chat. So,
Well, we're at pretty close to 12:45, and Sonja, this was really informative, and look forward to getting the slides. And why don't we touch base too in a week or so about, if you did want to present it to the commissioner. I have some suggestions in terms of, in terms of that strategy on that.
Great, yeah. Again, any way we can pay it forward, it's all about the direct care workers and helping them and creating change.
And that's what your work did. Your work focuses on them, which often doesn't happen. So really appreciate it. Thank you. And thanks everybody. Have a great week. Thank you.